Hello, I'm Tad Conlin, Director of Professional Relations at Journey Medical, the medical dermatology company. And I'm here today with Dr. Liet N of Radiant Dermatology in Houston, Texas. And we're going to discuss solar elastosis. Hi, Doc. So what is solar elastosis?
So solar elastosis is related to photoaging. So I know it's a big, broad topic, but I feel like it's an important subject that we touch on because photoaging matters to people in Western society. You know, nobody wants to look aged and, have an appearance of loss of vitality, etc. And so there's a lot of factors that can affect solar elastosis. Our body naturally goes through an aging process as our cells replicate year after year. It does go through an aging process naturally, but environmental factors can also play a big role. The main one, of course, is UV radiation from sunlight. And what happens there is that the UV radiation creates a lot of reactive oxygen species, which can turn into oxidative stress that can affect DNA and breaks down DNA. And that in turn does a lot of biological effects, but shows up clinically as wrinkles, dilated blood vessels. You see thick leathery skin, all the signs that you see from sun and photoaging, essentially.
Are there treatments for those that may be experiencing some of these symptoms and dealing with this condition? Are there treatments that are currently available?
So there are many treatments that are out there. I'm sure many of them are familiar with you if you've heard of sunscreens and topical retinoids, antioxidants, procedures including chemical peels or microneedling, radiofrequency, various lasers. They all have their pros and cons, so certainly talk to your local dermatologist for options.
And prevention is huge when it comes to this, right? And so can you speak to that somewhat?
Sure. So the main thing about solar elastosis is you want to prevent it because it's much easier to prevent than to go through the treatments. I always tell my patients, put on a topical antioxidant before you step out of the house in the morning. Antioxidants serve like a sponge. The most common ones are vitamin C based, and there's many brands available. So think of sunscreen as a shield. Once the UV radiation penetrates beyond that layer, then it hits the antioxidants. That's where it absorbs a lot of the free radicals that are created by the UV radiation. Of course, putting on a broad spectrum sunscreen is always a good idea. And sunscreens, there are many types. When they first initially designed sunscreen and the SPF rating, they primarily look at just UVB. So ultraviolet light has A, B, and C range, but broad spectrum incorporates the UVA, which are important for preventing anti-aging and also skin cancers. I want to touch on a recent article that came out in May of this year that highlighted tinted sunscreens and the importance of that. So certainly UV radiation is the big culprit that affects a lot of the cells and DNA, but visible light hits our skin way more than UV radiation. And so there are certain skin types that are affected more by visible light. And so the visible light, as a reminder, are your reds, greens, blue, yellow, the lights that we can see, right? So when you're fair skin, visible light can give you redness, and if you're pigmented skin, it can affect pigmentation conditions. So conditions like melasma or solar urticaria or hives from sun, chronic sun-induced dermatitis, as we say. So there's a number of conditions that can get affected by just visible light. So it was interesting that they highlighted that tinted sunscreens do a much better job than non-tinted to block the visible light. So when next time you go to the drugstore and you're looking for something that helps with visible light blockage, look for tinted and it's normally not in the active ingredients, it's in the inactive area where it'll list iron oxide or the particulated titanium dioxide. Try that next time if you're having a condition that you may be thinking that you're sensitive to visible light.
Thanks. There are tons of sunscreens out there, and that's really helpful as far as trying to discern what to use. As far as for those that are watching, next steps, if they may be dealing with this, what would you recommend?
Well, certainly prevention is always key. Wear a good antioxidant, avoid peak sun hours, protective clothing, find a broad spectrum sunscreen, or now with a tinted sunscreen. That's the most important thing. But if you've already experienced signs of aging, solar elastosis as our topic is today, talk to your local medical professional, local dermatologist. You can always go to aad.org. There's a lot of good useful information. As far as our practice, we always do a evaluation of the patient and then also kind of see what bothers the patient, and we tailor our treatments to our patient's needs.
Great, thank you. On behalf of Journey Medical, the medical dermatology company, I'd like to thank Dr. Lee and Radiant Dermatology.
Thank you.